Hi, my name is Hinte and I'm going to tell you something about the LGBT community in Malawi and one of the biggest healthcare problems most members of this community face, HIV/AIDS. To understand the big picture, I rounded up some numbers. Malawi has a population size of 20.18 million, which is currently growing with 2.6%. The population consists of more men than women, and by far the most people are under the age of 40. The life expectancy is also quite low, with it only being 64. The number one cause of death in Malawi is HIV/AIDS, which is often prevalent in the LGBT community. In 2020, 930,000 adults in Malawi had HIV, with an incidence of 18,000 in the same year. This means that in 2020, Malawi had an HIV morbidity of 948,000 people, 33% of which didn't receive treatment, and by far the biggest part of those people were LGBT. Sadly, also 9,800 people died in that same year from HIV/AIDS. Because HIV/AIDS is the number one cause of death, a lot of healthcare provided is dedicated to preventing, diagnosing, and treating HIV. As a nurse, you find HIV patients everywhere, from community care to tertiary care facilities, and working from public to private for-profit organizations. Providing healthcare for these patients can mean very different things as well. You could be educating locals about safe sex and HIV in an outpost and referring them, provide them with medication in a local village clinic, or care for them in the HIV/AIDS ward of a hospital. Sadly though, most LGBT people don't receive treatment. The reason for this might shock you, it's because of the law. In Malawi, it's illegal to be gay and it can be punished with up to 14 years in prison with corporal punishment. If someone finds out you did an act of gross indecency, you can be punished with 5 to 7 years, and having hair longer than a certain length as a man can even lead to being in jail for up to 3 to 6 months and a fine. These laws are probably heavily influenced by the main religion in Malawi, Christianity. This religion often doesn't allow LGBT practices, and therefore many Christian politicians agree with the current laws. Because of these laws, few LGBT people dare to seek help with HIV/AIDS problems in fear of being caught and reprimanded, not only from professionals but also from local medicine men. There are also too many stories about physical or mental abuse they suffered from by the hands of the healthcare professionals, who, because of their own religion or belief, often refuse to provide care for LGBT people. Luckily, the community in Malawi is gaining more attention and more people dare to come out in search for equality. In 2014, the first LGBT movement was founded, the NYASA Rainbow Alliance. This group is working to increase the scope of the existing organizational landscape and address some of the gaps identified by the members of the community themselves. They set up Safe House project with activities around mental health, education and religion. They also conduct surveys to get a better look on the community needs. There are also HIV/AIDS specific initiatives who are striving for a more sustainable life for the LGBT community, Frontline AIDS for example. This organization has many programs to help people with HIV/AIDS, working toward equal care for everyone. In Malawi, they have different projects specifically for LGBT people, one of which is the Rapid Response Fund. With this fund, they help in 3 different ways: to provide emergency financial grants to organizations, to support organizations in strengthening their capacity for emergency human rights response work, and to document and to share what works to help influence the decisions by governments and donors. So luckily the community is gaining traction and progress is being made. But to see how big that progress actually is, I'm going to place it next to the SDGs, the Sustainable Development Goals. The UNDP organization made an overview of the goals for Malawi, and that gives us a perfect list of the positive changes that are already happening. The 3 most important SDGs that need to change in relationship to this topic are the gender equality, good health and well-being, and the peace, justice and strong institution goals. On this list you can see an overview of objectives that are being worked on, for example by the organizations I talked about previously. Frontline AIDS works on financing and the access of medication, therefore trying to put an end to the AIDS epidemic. And the Rainbow Alliance works on education, collects data and fights for equal rights for everyone. So it can be concluded that parts of these goals are already getting met, but Malawi still has a long way to go before aspects like absolute gender equality are realized. But how? One way to implement change is to follow Kurt Lewin's model of change. This model consists of 3 steps: unfreezing, changing and refreezing. In the first step, Lewin suggests there should be a large agitation to the equilibrium state of a group to unfreeze them. Then they can move on to the phase of changing, where the actual changes are implemented. This is not an easy step though, and a good leadership and information flow are key for a long-term effective change. Then the last phase can be started, the refreezing. This means keeping the changes in place and maintaining steps necessary to sustain these changes. If the previous steps aren't properly done, this last step will be futile. So, as you've probably guessed, the proper healthcare for the LGBT community is still only at the beginning of the unfreezing stage. But I believe this can be pushed to the changing phase, only not currently. The fact is, the group stuck in the equilibrium state, the Christians, far outnumbers the people fighting for LGBT rights. So the stirrup Lewin describes necessary is not large enough to unfreeze the Malawian population. Therefore, I think the biggest factor is time. Time for the current organizations to gain more traction, for them to grow, for them to support other movements, and eventually to create a big enough ruckus to unfreeze the Malawian people. But of course, good communication is also necessary for change. Therefore, it's interesting to look into the communication in Malawi. Sadly, I couldn't find much on this, and therefore I can only hypothesize. I think that the communication in Malawi can be fitted into 3 models. First off, the linear model. This could represent the professional communication between me as a foreign intern and a local nurse. Because of the hierarchy, she will convey a single message to me. This could be disrupted by, say, a language barrier, but is expected to be comprehended by me, no questions asked. During communication between nurses and doctors, I think it's like the interactive model. There is still only one message being conveyed because of the hierarchy, but in this case there is room for feedback. Also, both parties have a field of experience that colors their interaction. Lastly, I think the private communication between locals follows the transactional model. Here, both parties are communicators, being able to send and receive messages simultaneously. Also, the fields of experiences are always shared, meaning that there is overlap in, for example, culture to interact. Of course, my hypothesis could be wrong, and I'm interested to find out if it is. But this is certainly not the only thing I look forward to experiencing. I'm also very curious how I develop myself whilst I'm there. Particularly on 3 different personality traits: my creativity, my eagerness to learn, and my ability to be caring. In my opinion, these are 3 of my best traits, and therefore I cannot wait to use them while abroad. I'm eager to find out how I can use each one of them separately or combined in both private and professional settings, to learn how to implement them even better, and to explore their possible downfalls as well. And lastly, to notice the difference between how I show them here and how I show them whilst abroad. All in all, I cannot wait to go abroad and visit the beautiful country of Malawi. Thank you for your time and interest. I hope you learned something and I spread some awareness, because after all, there's no change without it.